Welcome back to the channel with me, your host, Dr. Debra Durst, and my co-host.
Hey guys, my name is Faraday Golembieski, and I am a board certified family nurse practitioner at RevitalyzeMD.
So today we are going to talk about andropause, what it is, what kind of treatments are available, what kind of symptoms you would have. But before we do, hit the subscribe button. So we'll get into it now. What is andropause exactly?
So, andropause is the term for male menopause. It is the symptoms that are associated with the decline of testosterone, typically affecting men as early as their 40s, but mostly into their 50s.
Yeah, and testosterone is the primary hormone in men. And so this is when it declines, and it does decline significantly over time. We say about 40% of men at 40, 50% of men at 50, 70 at 70,
So
and
on
so
and so
on.
forth
Yeah.
until you die.
And that's just a general term that you can think about but when you're thinking about whether you have low testosterone and you're in your 40s, well, maybe there's about a 40% chance.
And one of the
So,
biggest difference between men and women is that men, this happens gradually over time.
yes. And with women, ours isn't a gradual, it's kind of a fluctuation, at least
And
with
then abrupt.
progesterone and estrogen. Testosterone probably pretty much does the same thing, but estrogen, progesterone are fluctuating and then they're not. Yeah. So, but basically, what are the symptoms that you have? So it's very similar to what women have when it comes to brain fog, energy, libido that's dropping, body
Body
composition,
composition changes.
and
So,
weight
especially for
gain.
men, it's waistline, abdominal weight gain.
And things you don't think about: sleep and mood. So you will sleep poorly when your testosterone drops, and then just that mood is it's a life force for men and for women. And so this is affects you. You just don't feel the same. You don't have that competitive edge. So if that feels like you, then it's time to have your hormones looked at. And then the behind the scenes things that it does, like testosterone, we'll just talk about all the preventative stuff. So stick around to the very end of it. So, testosterone, when we're doing levels, we have those symptoms. A man is thinking, and we see this on a daily basis, there's something that's bothering them and prompts them to come into the office. So, it could be energy for one, it could be weight gain, it could be recovery. That's one we didn't mention. They're just not recovering from their workouts, they're not building muscle like they used to. They have joint aches and pains, or it could be libido and erection issues. So,
Typically, I think that's what usually gets guys in the office. Everything else, men, you're really good at explaining away or ignoring until it affects libido and sexual function.
yeah.
But I think it's really important to note that decreased testosterone is not just about libido and sexual function. It is all those other things. It is also that fatigue, that midday exhaustion. Why am I taking a nap? I am not a
Mhm.
napper. I'm having a hard time thinking clearly. I'm not as confident. I don't have, I'm gaining weight. I'm in the gym. My recovery is not great. I'm doing all
Gotcha.
these things and I'm not making gains. What's going on? And then, like Dr. Durst pointed out, the sleep is
Mhm.
huge and the mood, those as
Says,
well.
and something prompts you to come into the office. So, what we're going to do is sit down with you, talk about your medical history and all those symptoms you are having, get blood work, and then sit back down and talk those numbers. And so, when we're talking numbers and potential treatments, and even we're talking numbers, there's a wide range for testosterone. If you're looking at total testosterone, maybe 300, and it's a little bit less than that, but it's 300 and 900. Use that as an example. That's a wide range. You could have been 900, now you're 300. So, is that really normal? I've done other videos on that. Is it really normal? And because frequently men are told that, but also we want to look at other data points like how are you binding to sex hormone binding globulin, what's your estrogen look like, what's your free testosterone,
Which are
and
bioavailable, all of
yeah,
that.
so there's a
It
lot of
matters.
other things that we look at when we're making a treatment plan for men. And then if you have a testosterone that needs to be optimized based on symptoms and a level, then we want to make that decision that's right for you. And there's lots of different options. So that's when we end up talking about what are the options that we can do.
And there's a
So,
lot out there.
yeah.
Some of them we utilize and some we don't.
And that's based on an experience and what we're seeing with men. And so, obviously, test injections are the most common. Let's just start with the most common one
Yeah.
because there's low T clinics all over the place. It
It's what
is,
primary, if they're doing, they're comfortable with.
there's no standard for that, whether it's once a week, twice a week, once every 2 weeks, once a month. We've
I
seen
had
it
someone
all.
come in the other day
Seen
and
it
say they were
all.
prescribed once a month.
Yeah, no, I've seen that before
One
too.
cc, so 200 milligrams once a month.
So what does that say about the provider?
It's time to, I mean, if there's a reason that they're sitting down with us.
It just means that they're very scared, like they're trying. So I'll give them that, like the provider's trying, but is going to go overly cautious because there isn't like a lot of drive to go and learn that and deep dive into it because the insurance companies are still dictating what you do with it. And so, yeah,
And
we've
it's
seen it
not
all.
it's not outlined in school. At least as a nurse practitioner, we did not sit down and talk about hormones in depth in treatment protocols. It was
Yeah.
a gloss over. So everything that I've learned has been taking that time, getting that extra education, going to conferences, doing additional continued education, and learning this from other providers and research that is non-traditional.
And learning every day in the office and with our patients. And so it has been a long education. And for me, even before I put it into practice, it was about 8 years of it just educating because then you have to actually take the time to make it practical too. And then how does that change when you start treating patients based on some science, but maybe this is going well and that isn't. So this has been a long process of about 12 years of perfecting it, and just for us, over 5 at the current location. And so it is a learning process every day, but you want to go to somebody that actually will sit down, talk those numbers, and give you the different options. A test injectable isn't the only option, but there's lots of low T clinics doing that in primary care, dabbling in it, and it's a one size fits all. And that's just not always the best approach for you. But that's why men end up in front of us. So, test injections are one option. And again, most of the time, you are actually going to be using that at least twice a week. And so, anybody
At
getting
least through our clinic.
yeah. Well, anybody getting in really across the board, at least that
Should
should be
be.
done because of the half life. And so, if you're doing it once every 2 weeks or once a month, it probably is not, because you could split that dose and do it twice a week. And again, a 3 to 4 day half life would dictate that is your dosing schedule. So that's one option. And again, the FDA approved option is an injectable form, but you can have that compounded as well. You can put an astrazole in it. So
Which
there's
is
a,
an estrogen blocker if
yeah.
needed.
So that's a way to customize it for you. And so,
The other common option for treatment would be creams.
yes, and that's an FDA approved formulation as well, or
So
formulations.
creams or gels, they're typically applied upper arm, shoulder, and with that, you're using it daily. What we see in labs and clinic is that those patients tend to yo-yo a lot on their hormone levels. We see highs and lows on their testosterone, or we have trouble getting their testosterone high enough to be beneficial without using a lot of creams. So we're looking at an alternative option for those patients.
Yeah, so a lot of fluctuations get you peaks, and peaks get you conversions to things you don't want, such as DHT, which not that you don't want that, but if you're using it, because DHT is 10 times stronger, so you may feel better, but you could potentially get more in the way of side effects, especially with all
It's a
those
double-edged sword.
fluctuations. Yeah,
So
yeah.
important finding that balance and finding a provider that understands how to manage those balances.
Yes. And then the estrogen conversion would be higher too. And then just think one little fact that a lot of providers won't, and I haven't heard a lot about, is the 5 alpha reductase that converts testosterone into dihydrotestosterone, or DHT, is in the hair follicle, which is in the skin. So if you're putting it on topically, you'll get more conversions, more in the way of side effects. So if hair loss or thinning is an issue, then creams may not be your friend. And so something to think about, where injectables, you're going underneath the skin and bypassing the hair follicle. And then again, one of our favorite treatments is pellets. And so you can use testosterone in a pellet form as well. And that is a pellet that has basically the hormone and the binder. The binder that we use is cholesterol because then it helps incorporate it into the fat, and there isn't anything left after the pellets dissolve. More release when you're active, less release when you're not active, and just a more steady release. But with men, you do get way more in the way of pellets than a woman would get. And so, it's a little bit more of a procedure for men, and you may have some soreness and bruising at the site for
But
a
that's
few
typically pretty
days.
quick. within a
It
week, you
is.
should be back to all your normal activities without any restrictions.
Yes. It's just less of an issue, no brainer for women because it's a small procedure and issue. But like on the plus side, the advantage for men is you don't have to do an oil injection
Or a cream.
with a deep shot and with a large needle twice a week.
Yeah.
So that's the advantage. You don't have to worry about any of that and the
And we get
timing.
compliance.
Yes. And men love it. So, one of the best ways to get men or women feeling better is pellets, but injectables are another great option. And we just use very little in the way of creams and gels.
The other one we didn't talk about because we don't utilize it is oral testosterone because it goes through the liver and it can cause liver toxicity and negative liver enzyme elevation.
And I don't think there's an oral formulation FDA approved on the market anymore. And obviously, you can do anything from a standpoint of compounding but a troche is something that goes underneath the tongue and dissolves, and that you can have compounded, but we don't use very often. And it was methyl testosterone that was the oral that was taken
Yep.
off with the liver. But I think the issue is that when you're using a troche, you still get some oral, but think of troche and creams as that acute, like it'll shoot your levels up, but they don't sustain. So it's a jolt of testosterone and it's not a sustained level. So you just don't feel as well. And it's almost like a troche could be used pre-sex or pre-workout for a little, jolt
Yeah,
of
but there's other
something.
things for that
Yeah, correct. And
that
so
are way
we
better
don't, we
utilized
actually don't use it
at all.
in the troche form and again, creams or gels. So injections and pellets are our preferred way for all the reasons that we just
And
mentioned.
we
So,
see less negative side effects, better compliance, stable levels, better control overall, and our men tend to feel better on one of those two options.
and we, again, are seeing this on a daily basis all day long that men are happy with one of those two routes. And so, anyhow, let us know what you think. That's Andropause in a nutshell, the symptoms you have, some labs and some frequent touch points with patients, and then our treatment preferred options. And we'd love to hear what you're on, what you've been offered, what your best treatment option is, what you're happy with, because we want to hear from you. If you want to hear about anything else, we're willing to deep dive into anything sexual wellness or wellness, so just let us know.